Good afternoon, everyone. Thank you for joining us for this webinar, Public Perceptions of Smoke in Oregon and California. My name is Janine Creighton. I'm the Administrative Director for the Northwest Fire Science Consortium, and we're very pleased to be able to help present this webinar in our partnership with the PNW Research Station, Western Wildlands Environmental Threat Assessment Center, the Ohio State University, Oregon State University, and of course the Joint Fire Science Program. Just a few minutes before we get started, I would like to get an idea about who's here. So I'm going to put up just a couple very quick polls, and if you would please fill these out, that would be great. And I'm going to make sure that there we go. Good. And we can all see who's here and from where. And I see we have 40 people on today. Not everyone may want to put their location in. We'll give that a few minutes. All right. Okay, let's do another one. Up, we still have more. Great. Looks like we have a really good mix of folks out here today. All right, here's our second one. I see. All right, great. Okay, and finally, one more. And hopefully I have enough up there that everybody can put something in. The other is always a good catch-all. All right. Okay, well, a few more stragglers here. Well, we're finishing this up. The way that we are going to operate this webinar today is we will have about 20-25 minutes of presentation, and then there will be time for questions, and then we'll have about 15 more minutes of presentation, and then more time for questions at the very end. So please feel free to use the chat and put your questions in the chat area, and then we will make sure that they all get addressed at the breaks when we have our question breaks. All right, well, without further ado, I would like to welcome our speakers. Our first speaker up is Christine Olson, I believe. Oh, no, I'm sorry, Eric. Eric Toman from the Ohio State University. All right, Eric, welcome.
Thank you. And Janine, can you hear me? Is this sounding okay?
I can hear you. Hopefully everyone else can as well. If not, please indicate as such in the chat. Okay.
Perfect. Thank you. So I'm grateful to be here and be able to join you today, and also to be able to kick things off for our group. And I'll try to be relatively quick with the introduction, and then I'll be passing things over to Christine, and we'll move on from there to do some presentation of results. Um, so we'll be talking a bit about a project that we have ongoing. You'll see where we're doing work. We've got several study locations, and we'll primarily today be talking about research and our results from um, Oregon and California from two of our study locations. All right. So, okay, Janine, I'm trying to advance the slides and I'm not. Oh, there we go. Perfect. Um, so this is what we'll plan to do today, just a brief outline. So I'm doing this introduction. Then Christine will present a bit about our interview and survey work in California and Oregon. We'll take a break at that point for questions. And then Stacy Frederick, graduate student working with myself, or working with Christine and myself, but there at Oregon State University, will present findings from her study, which was looking at a second round, a longitudinal study of responses in California, and then we'll take time for more questions. Um, so beginning this and sort of thinking about this, the question here, I think all of us probably know, we've interacted and dealt with the fire issue in one way or another, probably for several years. So we all know about the trends in fires nationwide, as well as the development in the wildland urban interface, or the WUI. And so one of the questions we might have is, what do we know about people in fire? And there really is a substantial amount of research that has been conducted on people in fire. A recent GTR that I was able to participate in, we actually reviewed the fire science literature, social science literature on fire, and we looked at publications that were either published and/or in press, and these were either peer-reviewed in scientific journals or in general technical reports. And between 2000 and 2010, we identified more than 200 publications and more than 100 authors that had contributed to research that fell into these, this broad category of social science and fire. So a substantial amount of research has been conducted, and we've definitely gained a lot of knowledge from those studies, as well as many of you who are joining us today have your own practical experience working with communities and interacting with individuals regarding fire, and there's a huge amount of knowledge in that regard as well. However, when we look across these studies, there was really a limited amount of examination of perceptions of smoke and what were the things that contributed to either acceptance of smoke impacts or knowledge about smoke. And this, you'll see on this slide, this is just looking at the publications that we found by year, actually going back beyond the 2000 to 2010 time period, from the 1970s when the first articles were published. And you'll see there's a little jump there around the Yellowstone fires. But then really the majority of publications, so this number of publications, have really been completed since 2000. A lot of this work was funded by the Giant Fire Science Program, including this project, as well as money that came from the National Fire Plan, working through Forest Service research stations, and several other sources. But you can see much of this work has been conducted really since 2000. I mentioned the general technical report earlier, and I would put this out there as a potential resource for you. This was something that we had done, and our goal was to look across the literature on social science of related to fire and identify really sort of key themes that emerge. So conduct a meta-analysis across this, or really a systematic review, and look at the key themes that emerge from this research, and try to identify key lessons for managers as well. So the goal of that publication is that the findings and things will be crystallized and will be applicable and useful for managers on the ground. So just want to note that and make that available for you if you're interested. But as I was noting, really there was limited research on smoke, and there's a whole lot of research on the social science aspects of fire, and a lot of that did look at public acceptance of things like prescribed burns. And within these studies, there might be a few questions related to smoke. So a lot of these studies had 1 to 3 questions or so, and they would report these tables and just a few findings about acceptance of smoke, but really did little to delve into what it was, what are the factors that actually contribute to that acceptance of smoke, or to really look at it any sort of specific or complex way. Um, this is true, except for there was one study among these 200 plus that really focuses on smoke specifically. This was a qualitative study, so based on focus groups, primarily in Inland West, so uh, Eastern Washington area, and the authors here found that there were a few things that are pretty interesting that merited, I think, additional work. But they found that acceptance of smoke could vary depending on the source of the smoke. So that their participants were more likely to accept smoke that came from prescribed fire than from agricultural burning, and they specifically noted this idea that the benefits of prescribed fire accrued to many through improved forest health or reduced risk of fire, whereas agriculture burning may only benefit the farmer. This is an important note because often, and one of the questions we've asked in our surveys is whether or not people can actually distinguish the source of smoke, and if they know where it's coming from a managed prescribed fire versus wildland fire or agricultural burning or other sources. And the second point noted here is that while the source can matter, few within this focus group volunteered or distinguished between smoke from wildland or prescribed fire. When it was raised by the research team, the participants indicated that they would have greater acceptance for smoke from prescribed fire, and they recognized that by having some smoke now in a managed form through prescribed fires, that might limit future smoke through wildland fires. So, why is this a big deal? Again, this is probably something you can answer, easier than I could, or from your own practical experience. Most of you have likely had some experiences with why people are or express concerns with smoke. So certainly, one of the reasons is when you conduct a prescribed burn or there's a wildland fire, the impacts of that fire occur certainly where the fire is burning, but the impacts of smoke can spread well beyond just the burning area. It can lead to things like health impacts, reduced visibility, and odor concerns much beyond the area where the fire is burning. And I think again, many of you have probably experienced this that smoke has a way, probably in some ways because of that large scale nature or the large scale nature of the potential impacts to result in vocal opposition. So even if very few people may have opposition or be impacted or have concerns, they may be more likely to step up and express those concerns as it relates to smoke than maybe with other aspects of forest or fire management, which can influence the acceptability or the ability to use prescribed fires. So as a result, really of these things, the Joint Fire Science Program recognized the need to increase understanding of smoke and spent quite a bit of time developing a smoke science plan, conducting interactions with practitioners through focus groups as well as through survey, a web-based survey that they conducted a number of years back. The Smoke Science Plan was released in 2010, and it's a very broad reaching science plan, including work on modeling and particulates and things of that nature, as well as research more into the components that we'll be talking about today. So things like beliefs and attitudes and understanding, and what are the things that influence acceptance of smoke. This resulted in a call for proposals that was released in 2010. We developed this proposal and were selected for funding by the Joint Fire Science Program. We also received additional funding from the Western Wildland Environmental Threat Assessment Center, so WETAC, that's based there at the PNW Research Station, that allowed us to expand our activities to an additional study site. And I think this is where Christine is going to take over. Are you on, Christine? Perfect.
Yep, I'm here. So I'm going to start talking about what we've actually done and give you some results that we think are really interesting. I do want to show you, though, this big map of the United States. Eric mentioned that we worked in a number of study sites. We were in South Carolina, Montana, Oregon, and California, although today in our webinar we're going to talk pretty much just about the Oregon and California data. So specifically, we chose study locations that were impacted by fire frequently, had a lot of smoke concerns that we'd heard about. When we made some initial calls, we checked in about the frequency with which locations had been recently studied, and also checked in about recent very large fires, and ended up choosing these two sites So basically communities surrounding the Fremont-Wenema National Forest in Oregon, in Lake and Klamath counties, and communities near the Shasta Trinity National Forest in California, in Shasta and Trinity counties, and then a few select zip codes in Siskiyou County as well. So the methods we've used in our project so far is a 4-phase project, and our first year, basically, we spent choosing our sites and making visits to those sites and conducting interviews, because, as Eric said, there has been so little work on social science related to smoke in the past. We really needed to go out and do some interviews and do some exploratory work and try to understand, first of all, what's the scene and what's going on, and help us develop really essentially the rest of the project and how it was going to go. After completing those interviews, then we did have some surveys among the public done in 2012, and we used the interview data to help inform how we were going to ask our survey questions. So that was very helpful. Our third phase was to repeat the survey in California only, and as a longitudinal study, which Stacy, my partner, will speak a little bit more about. So we had the chance there to look at changes over time between 2012 and 2013. And then our fourth step, which is still in the planning and implementation phase right now, this is ongoing work, is to try testing out a few new communication ideas. I want to give you a little bit of information about some of our interview findings. We did conduct a total of 28 interviews in the 2 states, and we spoke with a variety of different folks, primarily those involved in either land, fire, or air quality management, but also some in local NGOs, fire protection, a few private individuals. And we asked questions about fire and smoke management in general, past experiences, specifics about regulations in those locations, and about communication that was used related to both fire and smoke. A few highlights of the findings specifically from Oregon were that concerns over non-attainment status were really key. That at the time, Klamath Falls, one of the largest cities in our study region, was designated non-attainment, and Lakeview, another major community, was on the verge of non-attainment as well. So that was a big issue, and there was a lot of conversation about that. There was also this perception about public misunderstanding about the boundaries between different land management types and the regulations related to those. For example, in the non-attainment zones, there was some sentiment that our interviewees expressed that they had heard from the public, that when they see the federal agencies or other larger burners burning down the road, that they don't understand why they personally, a member of the public living in town, can't use their wood stove for heat. And in some cases that was true, where fires were permitted outside of the non-attainment zones, while wood stove burning was not permitted inside. So there was definitely this perception of this misunderstanding. There was also a broad belief that across the agency members, across the public we spoke to, across all of them, that in general they did not feel that there was enough communication going on about smoke specifically. Everyone knew that there just wasn't enough, and it wasn't good enough yet. So everyone knew there was some work to be done. In this particular site, there was a major prescribed fire smoke event that was also a major topic of conversation outside of the community of Lakeview, which gave a good example of for us in learning about what happens when there's a major event. It was a planned prescribed fire, but the smoke and weather changed, and smoke impacts were far greater than was anticipated. And then also in Oregon, there was this idea that and hope that utilizing biomass may be able to help in the future with the need to reduce fuels and the need to often take care of those fuels without using fire when in some circumstances because of air quality regulations. A few specifics from California. Again, there was some misunderstanding, perceptions about misunderstanding of policy about when prescribed fire is used and when it is not used, and when a wildland fire use or let burn fire is permitted. There were a lot of concerns about impacts on recreation and local economies. There was a considerable amount of conversation about the airshed coordinating group, which runs in that area, um, which essentially, for those that aren't familiar with most of the large burners, um, federal burners, but also others, having daily conversations to plan out and be aware of what everyone was doing. And in this example in California, it was something that we identified that was working very well. And so a lot of conversation was centered around that group. And then another piece was just that the wildland urban interface here was very patchy and widespread, so that was at a challenge for managing smoke, particularly when talking about a potential prescribed fire. Some cross-cutting issues that came up in both locations were relevant to prescribed fire, specifically a common concern, liabilities and related to escapes. But other items that came up a lot was the importance of being open and honest about um, fire plans, smoke plans, and experiences, and also mistakes that are made. The track record of personnel was also an issue that came up quite a bit, both in terms of activities that individual personnel had done over time and building their history and their relationship with local communities, but also in the longevity of individuals being able to be in one place to build that relationship. There was desire for updated information and terms of the public always wanting to have more updated information, more accurate information. And at the same time, the burners that we spoke with also looking for clear scientific guidance about what both fire and smoke research could tell them when making management decisions. There were concerns in both states about hindered economies because many of these communities were historically timber-based or natural resource-based communities with now shifting economies and at the time also a heavy recession hitting the entire country. And there was overwhelming perception of needing more communication and outreach relevant to everything related to fire, but specifically about smoke, which was the focus of our conversations. And then just a few tidbits, because I know we have a fair number of agency personnel on today. Some specifics that came from the agency members that we spoke to. There had been some experiences where there were conflicts between agencies, whether with actual management activities that were planned or communication activities that were planned. One example, actually, this was not in the California and Oregon site, but one that we had at our other location. I'll just share as a good example, but where two agencies were advertising and trying to raise public awareness about fire, where one was about don't burn in your backyard because you have to have your regulations, and another was prescribed fire is good and we need to accept fire. Unfortunately, having two billboards up side by side saying opposite things. So that's one example. Other agency perceptions are some lack of resources and the need for internal support. Specifically, hoping to have more time and more personnel resources and more supervisor and higher level support for the activities that go into communication and outreach activities related to fire and smoke. There was concern about this lack of consistent messaging, with that billboard example being a good thought, but also other types of messaging in terms of radio or brochure or other roadside signs. And there was interest overall in novel ways to communicate and recognition that same old wasn't always working, and they were not feeling they were reaching all the people that they had hoped to. And then one other piece is because communication had come up so much in these interviews, that we've have been digging a little bit deeper into the communication piece about smoke from the interviews. And this is comes from a an article that we are working on now that we hope to submit to environmental management at the end of this month. But specifically, we identified some challenges related to smoke communication that had come up. And broadly across all of those interview respondents from all our sites was this idea of they're uncertain about the effectiveness about the communication strategies they are using. They don't know if what they're doing is reaching the people they want and if it's reaching them and they're getting the message. There's the challenge, as I've already said, about conflicting and confusing messages. And then there's some concern about internal priorities where in some cases it was not evident that communication and outreach was an internal priority and that it needed to be a greater focus in planning related to future management practices. And then some of the ways that people describe to us how they address these challenges were some nice findings here to think about. Specifically going across management boundaries and trying to have consistent and coordinated management, both in terms of the land management, but also in terms of communication. Trying and working really hard to improve that communication, making it an institutional priority, coordinating messages across and within agencies, and using social networks, not just Facebook, but other community groups and other phone tree type of outlets that were available, possibly set up for another purpose, but something that could be tapped into when information needed to be disseminated. And trying to optimize resources that are already in place. And finally, fostering relationships with the public, and a finding that comes up in a lot of social science work related to natural resources is the importance of engaging in person because of the opportunity for back and forth conversation and potential to build a trusting relationship, and also getting involved in local partnerships. So from all of those interviews, like I said, we developed some mail surveys that we sent out then. And in our California and Oregon samples, we had over 500 responses, roughly half and half from the two states. And I'll just give you a quick overview. We had of the respondents, a little over half were male, mean age 63, primarily Caucasian, and with some college and middle class. This is very typical of a natural resource survey response. I'm going to talk a little bit about some of the major categories that we asked about in the survey. And one of the first ones is this perceptions of risk. So we asked questions about how likely and how severe people believed that different smoke impacts would be for 8 different items, which I'm going to list out here in a moment. But so there's the likely question and the severity question, and each one was on a 1 to 7 scale. And then to determine the risk, we multiplied those together. So each one got a numerical score where 1 times 1 is 1, and that meant I don't see much risk, or a 7 times 7 being a 49, where that would be a high risk. So those 8 items, here I've just listed them from highest perceived risk to lowest perceived risk. Health, topping the list at the concerns that people perceived the most risk about. And then moving down, you see scenery, tourism, and impacts on recreation. Towards the bottom, then, you see that it was about activities on your property, your ability to travel, and your ability to work. So this is the rough order of perceptions of risk that were received on average from the two sites. We didn't find significant differences between Oregon and Oregon and California here, so they're combined. But I will point out, though, that next to family's health, number 1, you see that it had a mean of 22, and that when our scale was 1 to 49, a mean of 22 is not terribly high. So that suggests to us that while the health concerns topped the risk levels here in terms of in comparison to other activities, it actually wasn't that high. It wasn't as if we were seeing a mean score up in the 40s. But still, health at the top is an important consideration to remember. Another thing we asked about was trust, and how much trust that the respondents had for these different agencies you see listed across the bottom. Again, there was no Oregon, California difference, so they're all together here. And I've graphed only those who indicated at least a moderate level of trust. And so actually it's quite high across the board here. Even with the lowest bar being roughly half. One trend I will point out here, though, is that the higher level bars on the left side, the Department of Forestry, local Forest Service staff, forestry consultants, that these are more local level management units, having that higher level of trust. And then towards the right side is tending to be Air Resources Board and federal agencies, where slightly less trust for this managing of smoke. We asked some questions about basically how well are the agencies doing for these different bolded items across the bottom, managing forests, managing smoke, and reducing fire risk. And are they doing, and it was a scale 1 to 7, where it's poor to excellent. And again, I've graphed here only those who indicated at least a moderate level of 4 or higher. There were, again, no significant differences here between the states, but you can see some interesting things here. In general, the ratings were fairly high, which is great, but some little differences between the federal and the state levels. Interestingly, about equal when you came to managing smoke between federal and state. We followed on this communication theme and asking some specific questions about communication in the survey. And this was about communicating about smoke, that the federal or state agencies provide best available information about smoke, timely information about smoke, or enough information about smoke. And then here I've graphed those who agreed, those who were neutral, and those who disagreed with these statements. And I think one of the biggest items out of this one is how high the neutral category is. So there were a lot of folks who kind of were neither plus or minus. But then if you look at just the agree and the disagree columns, you see that the disagree column is higher than agree in all cases. So in general, it tells us that our publics in these locations were generally not completely satisfied with the communication about smoke in these categories from either state or federal groups, which was not a surprise given the findings we had heard from the interviews, when agencies themselves felt that there was more that could be done. We asked about specific communication sources as well. I'm going to list out those here in a moment, and these were done on a scale of 1 to 5, where something is very useful or something is not very useful. And then I've listed them here just in usefulness order, the top being the most useful, down to the bottom, the least useful. And TV and radio public service messages topping the list, as well as newspapers, magazines, friends, family, relatives, billboards, and road signs. A lot of things that are fairly passive ways of communicating, but that have the potential to reach pretty broad audiences, and could be updated with some relative frequency. As you move down the list, though, you see some other items that were also considered fairly useful: different call lines, websites, conversations with staff. And as you move down further, you see government public meetings down at number 14. That one never seems to rate terribly well. Environmental Protection Agency website, and flyers and door hangers at the very bottom. We looked further into those folks who actually seek out information about smoke, and tried to also assess whether people in general felt they had enough information about smoke to make their own personal decisions about safety and just general knowledge. And you can see here in California and Oregon, close to half, although a slight difference between the states, felt that they needed more info. So again, it seems that getting some more information out there may be beneficial. For those who do seek more information, most of them believe they don't have enough. That makes sense. They already use a lot more information sources than others, so they are exhausting or moving to exhaust the sources they feel they have access to, and they believe it's difficult to find additional information. They also tend to be the ones who are worried about smoke, which makes quite a bit of sense. Um, and then those who are worried about smoke tend to be the ones who believe they'll be impacted and the ones who live closer to burn areas. I'm going to try to move a little bit quicker. We have acceptance of smoke. So acceptability is a term not everyone is always familiar with, but basically it's when you are making a personal judgment comparison between different options using your affective and cognitive thoughts, values, and emotions, your knowledge or your lack of understanding. So we're going to look at a few slides about acceptance, and also important to note that there 71%, so a strong majority, did indicate that they could figure out the source of smoke. And again, the majority also saying that they felt that the type of fire producing the smoke would would influence their acceptance of that smoke. So these are the specific smoke types, fire types that we asked about: wildfire, prescribed fire, naturally ignited fire, or let burn type fire, agriculture, pile burn, and private lands burn. And this is just straight acceptance where it's I agree that it's acceptable to me, I'm neutral, or I disagree that it is acceptable to me. It's worthy to note, though, of course, that the wildfire one is at the top, and in general, we perceive that largely to be, well, it's unavoidable in many cases, and not something we can do much about. And in most cases, it's also being suppressed, and so they feel that what can be done is being done. But then, among the types of controlled or planned burns, prescribed fire had the highest level of acceptance. At the same time, though, those disagree categories are not small, and quite a few people indicating they are neutral. Neutral either because it's simply something they don't worry themselves about, or that they don't feel they have enough information to make a judgment yet. I'm going to look a little more closely, though, at these 4 types of fires and try to look at what influences acceptance. And we're going to do a quick look at some regression results that we did by state. And so in these tables, starting with the wildfire type of smoke, along the left side, I have different variables that we looked at in trying to determine how they may influence acceptance of smoke from a wildfire. And then I have it listed by state, a plus sign meaning that, for example, the top one, higher levels of confidence in the agencies to manage smoke tended to result in higher levels of acceptance of smoke from wildfire in both states. If the cell is blank, that means there was no significant relationship. And if the cell has a negative sign, then it was a negative relationship. So, for example, smoke risk, the higher perceived level of smoke risk someone had, the more likely they were to have less acceptance of smoke in Oregon. And more plus signs or more minus signs means it was a stronger relationship. At the very bottom, you can also see our adjusted R-squared value. That basically tells us what percentage of the responses we were able to predict using these variables. And in our area of science, that these adjusted R-square values are quite good. Let me add a few more here, though. We have prescribed fire, the naturally ignited or the let burn, and the pile burns to look at. And across the whole board, some interesting trends to look at is that positive level of association with smoke confidence in most categories. So higher confidence, higher levels of acceptance in general, with also, and quite understandably, negative relationship between risk and acceptance of smoke. We see fire type popped up in a couple of them. Education level was important in Oregon for 2 of the types of fires. And prescribed fire benefits, of course, showed up in the prescribed fire model. So just quickly in summary, most of the findings here that we found between the 2 states for these survey results were similar across the 2 states. information needs did seem to be quite high among the public, and folks were looking for more. And in general, not just more information, but that it needs to be better. It needs to be different. It needs to be in different formats in some cases. And we also saw in general that smoke resulting from fires that benefit most, such as a prescribed fire on public land, is more acceptable than smoke from private fires. So at this point, we'd like to take a very brief break for questions, maybe just 2 or 3 minutes. We're running a couple minutes long at this point.
You have one, just a comment from Don Hodge. I don't know if you want to address it. Would be interesting to know perceptions of likelihood and severity separately, and which influenced overall risk perceptions more.
That's an interesting question. I don't think I'm looking at my student who's done the analysis with me here, but we haven't entered the two likelihood and severity separately into our regressions, trying to look at which one influenced more. But we do have the straight values of what the likelihood and the severity were. And if you're interested, my contact information is at the very end of this presentation. And Dawn, if you'd like to send me a message, I can send you some of that data.
And Tim Klein from California says, what have you seen in your research or the literature about how past smoke impacts on communities from wildfires can affect public acceptance of smoke from prescribed or burn fires? And here he's thinking of the rim fire.
Good question. I'm going to ask my my compadre here, Stacy, to help chime in on this. But if I recall right, we looked at past fire and smoke experiences, and am I right, Stacy? We didn't find that played out. True?
Yeah, and I mean, when we look at the longitudinal stuff here,
right. Okay, so Stacy's going to bring it up again in the second little part of the presentation, but we didn't find that was something significant as a predictor in the results you've seen so far. You would think it would be, but it didn't play out in the data we have.
Okay, and Ann Hobbs, when it comes to fires in very popular tourist areas with a very large transient population vacationing, it would be interesting to find out what those types of public perception.
Also a good point. I will add that we had a little bit of that we touched on in the South Carolina site that we looked at. Of course, I didn't talk about that today, but that particular location was outside of Charleston, and so with much bigger urban centers. Good point. I think, Janine, we probably need to move to the next part.
That sounds great.
If anyone has any other additional questions, we're going to hopefully have some more time for that at the very end. And I'm going to pass the microphone over to Stacy Frederick. So here you go.
All right, thank you very much. So for the last few minutes of this presentation here, I'm going to be sharing with you the results from our longitudinal analysis. So this part of the study, as was mentioned before, was only sent to respondents in California. A longitudinal panel study just means that we use the same individuals, we ask them the same questions, but it's at different points in time. So by looking at the two responses, we can really see what happens over time and in context of kind of what's going on. So in this case, the active fire season that happened between the two survey points in Northern California. So again, this was a mail back response questionnaire. It was a little bit shorter than the first one. 61% of the people who responded from the first survey also responded in 2013. And again, it's that comparison between 2012 and 2013. So I'm going to try and be pretty brief here, but kind of going over what happened in between these two survey dates to kind of give us context for what changes we may or may not see. There was a lot of large fires. One of them was the Ponderosa fire. It's important to note because of the high media coverage, there was a lot of evacuations, and there was a number of residences and outbuildings that were destroyed. And in our specific survey areas, 1 residence and 5 outbuildings were actually destroyed from the Ponderosa fire. Another interesting one is the Bagley fire. It was quite large, 46,000 acres burned, also lightning caused. And this is just a really cool image from NASA here that shows the survey area in 2012, whichever way the wind was blowing, there was chances that smoke was going to be impacting them, even if they weren't right next to one of these large fires. So again, Reading right there is one of the places we surveyed, just to kind of give you some context. Another important thing about the Bagley fire was the number of campground, trail, and road closures. So we talked about how in California, people were really, they were really interested in the impacts for recreation and tourism, because that really is to some degree the lifeblood of the economies here. And of course, as you can see from this photo, this is producing a lot of smoke here. This is actually only at 5% containment, only 11,000 acres burned. So it got a lot bigger and produced a lot more smoke. Another one to talk about is the Reading fire. This was of note because it was a naturally ignited fire that started in Lassen National Park from a lightning strike. And then due to weather condition changes, it went out of containment. It got a lot larger than it was expected to. It went into areas it wasn't expected to, and it went onto state and federal lands. And, again, talking about recreation impacts here, it closed down campgrounds and trails, and it probably impacted a lot of the visitation levels for the park. Of course, there's a lot of other numerous small fires that I do not have time to talk about all of them, but basically a lot of fires happened. They caused evacuations, they caused smoke issues. Even, this coal fire, for example, sent smoke up to the interstate, sent smoke to Reading, just from its proximity, even if it didn't have any, property or large burn areas. Okay, so respondents, pretty similar to what we saw before, older, male. Interesting to note is that 30% of them said that they had a respiratory ailment. So when we're looking at that risk from health impacts of smoke, a third of the people here, that's a pretty salient issue for them. Also to note, this area is pretty prone to fires. It's nothing new to these residents. 84% said that it was likely a wildfire was going to be burning near their home in the next 5 years, and 30% of them are part of a community wildfire protection plan community. So some of the questions we asked, just to kind of see, we knew the context of what was going on here, but looking at what they specifically experienced, most had at least heard or read about or even experienced a fire in Northern California. Predominantly, people said that these are wildfires, but people also mentioned that they had experienced or heard about prescribed fires, pile burns, and agricultural burns. And a little over half said that they knew or experienced a prescribed fire that got out of control. So as someone just mentioned, one of the questions, this is this issue of when a fire gets out of control and it causes these impacts that weren't expected, how does that really influence the perception? So, we were able to kind of study that to some degree with this survey. And then, of course, we wanted to look at direct impacts. Most people didn't have any direct impacts from the fires. Only 13% said that their homes were threatened, 8% said that they were evacuated, and 2% actually had property damage. But 26% said that they knew of someone, so one of their friends had experienced one of those impacts. And looking at smoke, almost 80% said that they dealt with smoke from fires in 2012. But on a rating of 1 to 7, 1 being not severe and 7 being very severe, the average rating was only 4. So yeah, they experienced smoke, but it really wasn't that bad on average. Okay, getting into results here. I know we're getting short on time still. Risk perception. So the questions, like I said, that I'm going to talk about now are ones that you've seen before. So this is that question where we looked at a scale of 1 to 49, 1 being no risk, 49 being high risk, and looking at the changes between the 2 years. So for the most of them, the health impacts, the ability to work, the travel, or the road closure issues, there was no significant difference between the 2 years. But for these 3, negative impacts to scenery, reduced tourism, and reduced opportunities for them to personally recreate, there was significant increases of risk. So they were seeing that smoke impacts were causing more risks to these specific impacts. Agency trust, there was no significant change here between the 2 years, and it's really showing what Christine mentioned before. The more local entities are being more trusted in general than the more removed federal agencies. Agency confidence. So like I just mentioned, agency trust, that general rating really didn't change between the 2 years significantly, but where we start to see changes is with agency confidence. So these are specifically rating the agencies to do specific actions. Those specific actions are managing local forests, reducing fire risk, and managing smoke. There were significant changes in all 3 categories from federal agencies. So there was a significant decrease for people, for example, for federal agencies to manage local forests. And then it was similar in state agencies, but however, managing smoke, there was no change. So, we're really seeing that the changes when it deals with that public agency relationship isn't in this general overall trust from these issues or from these events. It's looking specifically at actions and ability to perform those management objectives. Communication sources, most of them, there was no change in usefulness. Flyers, door hangers, which was already the lowest rated source for communication from smoke, also decreased even more in 2013, so significant decrease there. Informational brochures decreased. However, TV and radio public service messages increased in their usefulness. And finally, looking at the smoke acceptance by origin. So this is kind of, one of the big questions. Given all these things that happened, the prescribed fires that got out of control, the experiences with smoke and with fire, I really expected to see a lot of differences, maybe some decreases, maybe some increases in smoke acceptance. But overall, there were no significant changes between 2012 and 2013 for any sources, anything. So wildfire, all the way down to private lands, there was no significant difference. It's still, same trend as before. So wildfire is the most acceptable source of smoke, with private and agricultural being less acceptable as seen in previous literature. But again, I think it's really interesting to note that it did not change between the 2 years. So basically, where we're seeing these changes are, those risk perceptions that were related directly to tourism and to scenery, which, given the site of Northern California and their reliance on recreation and also just personal, people living there who want to recreate. That was really interesting that the risk of that impact kind of increased. Agency abilities, so those specific actions decreased significantly, but overall trust did not, which has some implications there. And also the communication sources changing in usefulness, can deal with how we target our future communications. And what sources we really rely on. And finally, that lack of change in smoke acceptance, even given all those results. So I think with that, next steps. So as mentioned, this is kind of still an ongoing project. The future issues we want to look at really are focused on communication. So what encourages information seeking and effort and the processing of that information, looking at knowledge, beliefs, attitudes, and how those deal with smoke emissions. And finally, looking specifically at communication and how that influences the acceptability specifically of prescribed burns for management implications. With that, I think we have a few minutes left for questions.
Yes, we do. And I see we have some people typing. And so we should be getting a question up here very soon. Okay, Matt Dickinson asks, are people more accepting of smoke from distant sources, for example, wilderness areas, than smoke that is generated locally? And are managers off the hook if they impact distant sensitive targets? Who would like to take those?
So I just want to mention the last part there, our managers off the hook if they impact distant sensitive targets. Unlike fire, it's really hard to tell where smoke is coming from, but our respondents did say, or the majority of them said that they thought they could identify where the smoke was coming from. And I think in the future it'd be really interesting to look at whether or not that's true, if they actually know where the smoke is coming from, or if they just might think they do. Anything else to add on that?
So I was recalling from our interviews, and this was coming from managers, particularly in South Carolina. I recall this being raised repeatedly that if there was smoke, if there was smoke on the landscape, that the agency expected to get the blame for it. So even if it was agricultural burns or it's other burns happening, I think in some ways it's the agency managers are just a likely target. It's an organization that people know that they can point at and say that they may have impacted us. So the second question of are managers off the hook if they impact distant sensitive targets? The managers at the distant location may be in some ways off the hook, but the local managers may end up catching sort of some of the brunt, I think, of the concern for that smoke.
Okay. Here's an interesting question, an application question. Can any of the info in this presentation be used to increase prescribed fire activity by state and federal agencies? What are your takes on that?
I think I'll just talk to that briefly. I think that thinking back about the conversations and the interviews we'd had, I think that is certainly the hope by many of the people we talked to, that coming back with some of this information that it could be used to help increase prescribed fire activity. And I think to some extent that was also our hope in places where it's appropriate. But whether or not that can actually be applied, I think it's going to be a real contextual issue about how well the local community and the local managers have developed relationships with their local publics, and how they choose to take this information and to make some changes. So also, as Stacy mentioned, the next steps that we're going to look at for the last remaining year of this project is a little more on that communication piece, and we're going to be testing out some new ideas, basically, about ways to engage and to do some outreach about some of these issues. And so I think some of the results from that in particular may be something that could be actually applied and result in potentially some real change. Eric, would you add anything to that?
You know, I guess the only thing I would add, I think that was a good response. The thing I would add to, in general, sort of in the broader research on acceptance of prescribed fire and fuels treatments in general, there really is, so findings across nationwide and multiple study locations really find high levels of acceptance of these treatments. It doesn't mean that everyone at a location is going to be in support of them. And so probably often what happens when there are challenges at the local level, it may be a vocal minority, whereas the majority may be either accepting or just maybe not as tuned into the issue. Whereas those who have an issue to raise may be the ones that are most vocal about it, even if it's in a negative way. So I think Christine's comment about the importance of contextualizing and working to develop those local relationships is really important, and will allow managers to recognize the people who are in support of these treatments, and also to recognize what the concerns are for others and potentially work through them and develop trust that can help, ultimately help build support and acceptance for treatments.
Are there other questions, comments? Oh, we've got someone typing. I just put up there, just for those of you, while we're waiting for Priscilla's comment to arrive in the chat room. This webinar will be put up on the Northwest Fire Science Consortium website, probably by tomorrow, but it's better to assume it'll be Monday. So it will be archived, and the link will take you to our YouTube site. So if you want to forward that information to friends or whatever, then please do. Do we have another question or comment? I thought I saw somebody typing.
Janine, I'll add one more thing since it looks like we're closing out, but I put our contact information here on this last slide, and if anyone is interested in additional information, we do have little short summaries that we can send out about the interview results from the different states, and then we also have some summaries of the survey results at this point as well. So we're happy to share additional, more specific details for those interested.
Okay. Well, thank you all. Oh, here we go. Here's the question. Priscilla's curious. Do we know if at all the recent large fires in these areas or areas close by and the smoke and damage generated from those have potential influence on public perceptions and acceptance of smoke? Can these be teased apart? We've had such huge fires this time around.
I think that's a really good question, and I'm not sure that we can tease that apart very well from the data that we have, and just we had chosen, as I said earlier, sites that did not have really significant large fires in recent history, and so I think to really look at that, you'd have to have a combination of sites that did have that type of a large event historically. At the same time, though, I will point out again, though, that in our work, we did not find that past experience with smoke and fires was one of the major drivers. Even though it really does seem like you would think it would be, it wasn't something that rose to the top for the data we collected.
And are there plans to expand the surveys to look at other states?
If Joint Fire Science wants to pay for it, not at this time, but that's another good question. I'll also add too that there was this webinar has been all based on the project work from our team, Oregon State and Ohio State. But there was a second smoke project on social science funded at the same time out of University of Idaho with Troy Hall as the lead investigator. And if anyone is interested in getting in touch with her, I can provide that contact information because they surveyed a different suite of questions, but they surveyed also in the Northern Rockies and in parts of Texas and Louisiana, so some different areas.
Okay, great. Well, thank you so much. We are out of our time. Thanks again, Christine and Eric and Stacy for your presentation. And I hope everyone has a good day.